Welcome to the World Affairs Council State of the Women's Health Forum. My name is Judy Wyndham, and on behalf of Highmark and our Community Affairs team, we greet you. It is our privilege to host this year's Health Forum during Women's History Month. Highmark honors the women who have shattered barriers, defied expectations, and paved the way for our future generations. Today, March 8th, marks International Women's Day. Happy International Women's Day, women. Today, our guest panelists will share with you about issues affecting women's health, not only from a global perspective, but here in our own communities. At this time, I would like to introduce President and CEO of the World Affairs Council, Dr. Joyce Davis.
Thank you very much. It is wonderful to be here with you on International Women's Day. And one of the things I tell my American sisters all the time is that they don't know what a big deal this day is around the world. That I couldn't believe when I lived overseas. This is akin to Mother's Day, okay? So you understand how big it is. But I am really delighted to be here. This forum has been truly a group effort. And it has been the result of the hard work, the collaboration of the women at this table, and of course, Dr. Sharee Livingston, who will actually serve as our moderator for today. Now, I will tell you, this is part one of two events we're doing. We're starting here, looking at the global view. Later, on March 23rd, we're going to have a follow-up, and this will be a luncheon at the Civic Club, part of a weekend festival, Women's Festival. So check our website, World Affairs Council of Harrisburg, and you'll be able to see the events that we have planned coming up. That one will be March 23rd from 11 to 2, and it will also have, get ready for this, an international fashion show. Women from all over the world will be showing their traditional fashions, and we'll learn a little bit about their culture and their history. So you don't want to miss that one, okay? Check our website for more information. But now we've got a lot to talk about. The state of women's health, a global view. We have women who are expert and who have that global view to share with us today. I am going to turn this over, actually, to MC, to Dr. Sharee Livingston. She is in the OB-GYN department chair. She's the chair at UPMC Lids. She's a founding board member of Patients Are Waiting and co-founder of Diversifying Doulas Initiative. She specializes in obstetrics and gynecology and is board certified by the American Board of Obstetrics and Gynecology. And I'm going to have to tell you, she practices at UPMC obstetrics and gynecology in Lids, but her bio and the bios of all of these ladies, we will never hear from them, okay, if I go through it, because they are truly accomplished ladies. So Dr. Livingston will be here to serve as MC, but I think, do you want me to go forward with, okay. So the other speakers we have, just to get that off her plate, we're going to get our overview from Dr. Emuwa, and she pursued a career in medicine at Yale University with an interest in disease prevention and community health. She obtained a master's in public health at Harvard University. She completed her residency training in family medicine at Thomas Jefferson University Hospital, Philadelphia, and is also board certified in lifestyle medicine. She, again, has an extensive bio. And I will just tell you that she currently works at the University of Pennsylvania, Lancaster General Health System as a family physician and as co-chair of the Diversity, Equity, and Inclusion Advisory Council. So again, I could go on, but you don't want to waste your time here with a whole lot of introductions. Dr. Renu Joshi, we know her well because she is actually a member of the board of the World Affairs Council. She is an esteemed endocrinology physician at Mount Nittany Medical Center, and she boasts over 25 years of expertise in the greater Harrisburg area. Now, I know she and her husband actually have started a foundation, and they provide free medical care to people who need it. That's the kind of heart she has. She's a specialist in diabetes, She also is now looking into, issues involving particularly South Asians. And we were just talking about a documentary that they're working on to try to examine what's going on with heart disease in people of South Asian ancestry. So again, long bio, but we will move on to Mrs. Charity Nwaneri. She attended Queen's School in Nigeria. She obtained a bachelor's degree in nursing from Georgetown University and a master's degree in health services administration from George Washington University in DC. She's worked in different healthcare facilities in the US and Nigeria, and as a nurse and a health services administrator. She's always been passionate about the plight of the less privileged, and that's why she's here today. We also have Evelin La Paz. She's a Dominican Republic native, and now she calls Lancaster her home. For the past 15 years, she migrated to the US in 1985. With a diverse administrative background spanning the cruise line industry, jewelry, bilingual K-12 private education, and healthcare, she holds a master's and Bachelor of Science degree in healthcare administration. And for nearly 12 years, Mrs. La Paz has served as the manager of the Language Services Department at Penn Medicine Lancaster General Hospital. And if that weren't enough, we top it all with Tabita Tugulia. And she is originally from Romania. Did I do the R right? She is from Romania. And we've shared a little bit even here today, the issue of language when you're trying to navigate the healthcare system, right? Not only that, you're from a different culture. You don't understand us people, right? I mean, who steps in to help? Well, that's where Tabita comes in. She holds a master's in social work. She specializes in human development with family science and has served with 14 years as a Dauphin County. She is currently the fiscal contracting manager in the Human Services Director's Office, overseeing contracts between children and youth, juvenile probation, and private providers. Again, I'm going to stop it here. I think you get it. I think you get the expertise that's here, right? So now I invite Dr. Sharee Livingston to start our conversation.
Thank you, Joyce. Hello, I'm Dr. Sharee Livingston, born and raised here in Harrisburg, Pennsylvania. So I feel like I am back at home, y'all. Back at home. I'm practicing medicine in Lancaster. Great friends with many of the folks on the panel here. You are up for an amazing treat. There's going to be lots of education, but it will be provided in such a strategic way that it won't feel like you've come out without any goals or intention. And why did we plan this day? We planned it because International Women's Day is widely and wildly celebrated throughout the world. Here in the US, we take many things for granted, right? There are many of my colleagues who are seeing patients today, going about their business. Well, guess what? This team of women here said, we are going to stop going about our business today, and we are going to center women. We are going to center the lives and those things that are important to women. And without further ado, I think we jump right in. How about it, y'all? All righty. So my first question will go to Mrs. Nwaneri. Mrs. Nwaneri, can you share with us your perspective on the state of women's health as it relates to motherhood and infants? And with your background, please feel free to give us a specific emphasis on what's happening internationally, not just here locally in the US, but what's happening internationally in that perspective of motherhood and infants and how it relates.
Before we do that, I think Dr. Emuwa has
That's right. Yeah, I'm fine with us jumping right in with Dr. Emuwa's overview. All right, well then I'll back up and let's have Dr. Ada Emuwa grace us with her presentation.
Well, thank you very much, Dr. Livingston, for the opportunity to actually provide a few minutes of an overview, pretty much a way to navigate how we're going to celebrate and kind of start setting the stage for this important topic today. I did want to take a moment and pause and reiterate Happy International Women's Day. Yes, March 8th is the date that's set aside. It's actually started with getting celebrated in the early 1900s, but it's not only a day to celebrate, women in esteemed positions in our society today, but really celebrates all women, regardless of background, celebrate what all women bring to the table in our society today. It's also an opportunity for us to focus on women's rights, such as gender equality, abuse against women, and not only think about these issues, but start to think about strategies and ways we can accelerate solutions in our society. Let's see, to move forward. Thank you. And so if we start off by asking ourselves, what are some of the key issues that affect women in our society today? On a global level, the World Health Organization actually a few years ago set out some top priorities for us to focus in if we're trying to address issues that affect women today. One of the top priorities, addressing gender inequality, especially post-COVID. Women are facing new and emerging issues after the pandemic, specifically in regards to issues such as women who had to leave the workforce. Women are naturally nurturing souls. And by default, if there were two people in the household, adults, by default, the woman became the one to stay at home, take care of the children, take care of aging parents. Well, by the time they were now ready to return to the workforce, there were a lot of challenges involved, differences in terms of, income, differences in terms of trying to get back into their career projection. And that really created a lot of increased mental health issues amongst women. If one also thinks about services, support services, such as services available for domestic violence, a lot of these services got disrupted during COVID pandemic. Post-pandemic, a lot of these services were underfunded, funding going to higher priority resources. And so a lot of women did not have as much access to a lot of these resources as they did previously, which kind of takes us into the next priority, preventing and responding to violence against women. When we look at the statistics show that globally, 1 in every 3 women will experience violence in some way, whether it's psychologically, whether it's physically, whether it's emotionally. And if you pause and think and look around the room, 1 in every 3 women, these are devastating statistics. And so I'm not surprised that these are one of the top priorities the Women's Health Organization has set for us today. Going into another priority, ensuring quality sexual and reproductive health for all. A lot of these issues are going to be touched on by my fellow colleagues at the table today. When we even throw out some statistics, over 800 women still die every day in pregnancy and childbirth, with most of these women existing in sub-Saharan Africa. Think about it. An act that's supposed to bring life into the world actually can burden women with death. And so this is not a light issue to think about. It's something that definitely, I am not surprised, is on this list of priorities. Moving forward, reducing non-communicable diseases among women, for example, obesity, cervical cancer, breast cancer, mental health conditions. When we just look at mental health in of itself, depression is twice as common in women as in men. Again, we'll have the opportunity to go into detail on this further, but I just want to start to set the stage of some of these issues and how they affect women more specifically in our society today. Of interest, the next topic, increasing women's participation and leadership in science and public health. At first I was like, that's not a disease condition, so why is it on the World Health Organization list? And then I realized, it is a rhetorical question. If we think about it, women make up 70% of workers in the healthcare field, and yet vastly occupy fewer leadership roles than men and are paid less for doing the same work. So then it was an obvious reality. Yes, If we are going to address the state of women's health and improve the condition of women's health, we have to have women at the table. I'm fortunate to have my mother here present on the panel today. And there's an old African proverb that she likes to say, which is, it is he who wears the shoe who knows where it pinches. So yes, if you want to make change, if you want to have strategies that can be impactful, have people who have those experiences at the table. So I'm not surprised that this is on this list of priorities. If we want to advance women's health, we have to think of advancing women in leadership roles today. So even if we start to hone in internationally and come into the United States of America, the Office of Women's Health, United States Department of Health and Human Services, stated on their top priorities similar issues: reproductive and sexual health, heart's disease, physical activity, the lack of that, mental health, cancer, health disparities. Again, I was like, that doesn't look like a disease I learned in medical school. And then I remembered, health disparities, yes, even amongst women in our country today, all women don't have access to the same healthcare, whether it's socioeconomic, women who have more poverty than others, whether it's issues of race and how women are treated with bias, whether it's ethnicity or issues of language. All women need to have similar access to healthcare. And so I can see why health disparities is something that we really need to keep an eye on if we want to improve the health of women in the United States today. So many solutions to addressing all these issues, but one of the key strategies remains, and I know I'm biased as a family doctor, but prioritizing access to preventative health for women. During National Women's Health Week last year, the US office stated prioritizing women's health, overall health, not just physical health, psychological, emotional, social well-being has never been more important than today. Women, in most cases, primary caregivers, we typically have nurturing spirits, and yet we put the needs of others ahead of ourselves. But we all know that phrase when you're on an airplane. If anything happens in the event of an emergency, put oxygen on yourself first before that of your child. Women, we need to give the best care to ourselves if we want to prioritize taking care of others. So what do? Pause and ask yourself, who are the women that I know in my life, in my office, in my place of work, in my sphere of influence? Encourage those women to reflect on their individual needs and take steps to improve or maintain their own individual health. Ask yourself, are you one of those women? Do I need to pause? Do I need to start to take care of myself if I want to take care of others around me? So focusing on the different aspects of personal health. Remember, I talked about overall well-being, whether it's with nutrition, fruits and vegetables, at least every day, less processed foods, exercise, very important. No matter how much time you can get into your week, you start off with the day, optimally building up to 3 times a week, sleep up to 7 hours. I know a lot of women are like 7 hours, but you have to start from somewhere if you want to prioritize your health. Managing stress. I always tell my patients, you want to manage your stress before your stress manages you. And at the end of the day, people are like, well, where do I start, Dr. Mo? Where do I start? By going for your yearly clinical exams. Even if a doctor can point out or a clinician can point out your blind spot, oh, I didn't even know that this was a problem, or you have a problem and you don't know how to deal with it. But going for your yearly clinical exams is definitely a way for you to start taking steps towards getting overall health, a better overall health, towards a healthier future for yourself and the women around you. But everything I speak about will seem like it's in a vacuum if we don't recognize and address that there are barriers for women to resources and accessing optimal health care. How are you going to tell a woman to sleep for 7 hours if she's homeless? How are you going to tell someone to eat fruits and vegetables if she does not have access to buying healthy food, or the closest grocery store with fruits and vegetables are miles away? So we have to take a step back and ask ourselves, we have to start thinking of strategies to improve access for all women when it comes to healthcare. Ask yourself in your sphere of influence, in my organization, what can I do to optimize work conditions for women in my place? What is it that I can do to ensure that women in my environment have access to health services that allow them to take care of themselves and their children? Even if you feel there's nothing you can do, can I donate my money, time towards organizations? So many nonprofits exist where we can contribute something towards making the lives of other women in our environment much better. So I really want to thank you for the time you've given me today. And hopefully I've kind of set some stage from which we can, Dr. Livingston, we can take off and now start to address details of some of the things that I raised today. So I implore all of you to open your hearts, open your minds. We're not here just to watch, but we're here to ask ourselves, what can we take away towards making things better for myself and for the women around me? Thank you for your time.
Phenomenal woman, right? Wow. Thank you, Dr. Emuwa. I think that it's important to emphasize when you talked about the strategies of the Women's Health, World Health Organization and some of the things that they outline, when we talk about social determinants of health, which are lack of access to affordable health care, lack of transportation, education issues, we cannot forget the importance of addressing systemic and structural racism, because what lies at the base of racial health disparities is systemic and structural racism. And nobody likes to hear that. I don't like to say it. And I look forward to the day where I don't even have to bring it up. But I think that it is vital that when we have discussions like this, we understand implicit bias, which is the brain shortcut, but we know implicit bias leads to poorer health outcomes. Addressing social determinants of health, addressing systemic and structural racism. Those are mechanisms that we need to really undo the problems that we're going to address here. So without further ado, now I get to ask. I wanted to jump right into the questions because I know my folks out there, they're like, get to it. I want to hear some juice from these people. So Mrs. Nwaneri, can you share with us your perspective on the state of women's health as it relates to motherhood and infants? And please give us your international perspective.
Thank you, Dr. Livingston. Good afternoon, ladies.
Good afternoon.
Happy International Day, Women's Day to everybody. I would like to focus on Nigeria, which is where I come from, and we do a lot of our programs in Nigeria. By the way, I'm the president of a nonprofit organization called Wheel of Hope Initiative, and we do a lot of our programs in Nigeria. I'm using Nigeria because Nigeria is the most populous country in sub-Saharan Africa. It has the largest number of Blacks in the world. And yeah, so these are the reasons why I'm using Nigeria. There are some influencing factors that will be recurring during my discussions. These are things like culture, religion, socioeconomic status, government involvement, and education. They'll be recurring during my discussion. If we talk about women's health, it includes menstrual health, reproductive health, breast cancer and cervical cancer, because these are the two most prevalent cancers in women. Talk about HIV and sexually transmitted diseases, heart disease, heart health, and mental health. But I'm just going to focus on 2 or 3 of these conditions. When we talk about menstrual health, well, in the rural areas, which is where we operate most, we don't operate in urban areas. We operate in rural areas and underserved urban areas. The women there, they don't have money. There's abject poverty in those areas, and they don't have money to buy sanitary pads. So they resort to using rags or anything that they can lay their hands on. And, there is no water, so you have very unhygienic conditions. And what happens is that some of these girls, young girls or women, they end up with infections. And these infections have very serious consequences. Some of these infections, if they're not well treated, they end up with primary or secondary infertility later in their lives. And some of them even die from the infections. It can lead to septicemia, generalized infection, and they die just because they don't have access to sanitary pad, and they use anything, and there's shortage of water for them to, wash their hands and things like that. So it's very important to know that things you take for granted over here, over there, it means a lot. Then I talk about, when you also talk about menstrual health, there's stigma and taboo attached to it. In Nigeria, we have about 371 ethnic groups and different cultures. You'll be surprised that in some areas, when a woman is having her period, she's not allowed to visit some religious houses. If they allow her, she's not allowed to. She's restricted, from going to certain parts of the religious house. Also, some women, when they are having their period, they're not allowed to cook for their husbands. They are also not allowed to sleep on the same bed with their husbands. These are cultural things, that are associated with menstrual health in Nigeria, in some parts of Nigeria. Like I told you, we have many ethnic groups and different cultures. There's also also taboo or stigma attached to menstrual health in Nigeria. So these things are very, like I said, over here, things that you take for granted. Over there in Nigeria, we don't have them, we lack them. And because we lack those things, it affects a lot of things. It results in so many consequences. Like some of these things lead to diseases that can cause death for some women. Now we talk about breast cancer and cervical cancer, which I said are the two most prevalent cancers in women. In Nigeria, in some cultures, when a woman has breast cancer or cervical cancer, they think that it's a demonic attack or witchcraft. And because of that, they don't seek for medical attention. Mm-hmm. And that woman suffers, goes through that. The cancer gets metastasized until she passes. Just because of ignorance, lack of education, lack of knowledge about, the disease. So this is a very serious situation in Nigeria, in some parts of Nigeria. I keep saying it because, like I said, we have many different cultures, and some of them are, some of them have their own things that they practice. Another thing is where I'm going to concentrate on is prenatal care, our antenatal care. I'll focus on Nigeria. Like I said, it has one of the highest infant maternal mortality rate. And this is caused by so many things. Maternal health refers to the health of a woman during pregnancy, childbirth, and after pregnancy. Carrying a child or birthing a child takes a toll on women, as we all know. It's not easy. The following factors affect antenatal care. Things like medical and obstetrics causes. We have culture and religious causes. We have socioeconomic causes. We have government involvement and other miscellaneous causes. When we talk about medical and obstetrics causes, we have things like hemorrhage. infection, obstructive labor, unsafe abortion, and hypertensive diseases in pregnancy that lead to preeclampsia or eclampsia. About 70% of maternal deaths in Nigeria are due to obstetrics conditions. In medical causes, these medical conditions are preventable. Unfortunately, they're detectable and preventable. But because of the culture, lack of antenatal care, many women lose their lives. Think about a woman that has obstructive labor. This woman, in some culture, the women have no autonomy over their body. The man is in total control of your body. If you're pregnant, a man will tell you, decide on what to do. He might say you're not going to get antenatal care, and the woman stays at home. He might decide that his mother, his grandmother, and women in the community will do that delivery. And the woman carries the pregnancy all through. And when it's time for her to deliver, if she's lucky, she will have safe delivery. Where she's not lucky, maybe the baby is big, or the baby has a breech presentation like obstructed labor. They will struggle with this woman. The woman can be in labor for days. And eventually she gets exhausted, the baby gets exhausted, and both mother and child die. You know, and that leads to high infant maternal mortality rate in Nigeria. Things as simple as that. You know, a woman has no say about her condition. A man is in total control and dominates everything. You know, so it's very, very sad, you know, that she doesn't have any say about her life, about her condition. Another thing is the socioeconomic situation factor. There's great disparity between the rich and the poor. Of course, the rich people reside in urban areas, and in the rural areas, you have a lot of poor people. And rich people, they have access to, you know, medical care, while the people in the rural areas don't. They don't have easily accessible and affordable healthcare system. So as a result of that, they don't seek medical care, early medical care, and a lot of preventable diseases and conditions, you know, cannot be handled, and that leads to death in the women because of lack of access to medical care. I've talked about male domination over the women. They have absolute control over the women. Another thing is that when a woman is in labor, we have midwives in rural areas. We have more of midwives than, you know, OB-GYN doctors or registered nurses. We have midwives that do the deliveries. A man can say that doesn't want the wife to be exposed, to expose herself to anybody, particularly male doctors, OB-GYN. Some men, in some cultures, the men don't want their wives to be exposed, to expose themselves to people outside the family. So they want only women within the family that are not skilled, that are not educated to do the delivery. And a woman can be having delivery, and the baby comes out with a cord around the neck. And these unskilled women might not know how to maneuver the baby and remove the cord, get the cord out of the baby's neck. The baby dies out of strangulation. The baby gets strangulated by the cord, you know, and in so many cases, you lose the mother, you lose the baby. That's why we have high infant and maternal mortality rate in Nigeria. Another thing is the doctor-patient ratio is very, very low. In Nigeria, we have about 4 doctors to 10,000 patients. Nurses, we have 1 nurse to 1,160 patients. And 1 OB-GYN doctor to 181,000 patients. So you can, when you look at that statistics, you know what we're talking about. And I'm sure it's even worse now because a lot of doctors or medical practitioners are leaving the country. So it is a sad situation back home, over there. What happens in Nigeria is prevalent in other developing countries. I just focus on Nigeria because that is where we do a lot of our programs.
Wow.
Thanks
for those statistics and that very in-depth summary. When you talk about menstrual inequity, I think we need not forget why we're here. Can Tracy Jennings stand up? Tracy is the founder of Flow. I'm the co-founder of Flow. Thank you. Flow, she and I lead the organization. Our mission is to eliminate menstrual inequity. So for those who brought products, thank you. For those who intend to support, thank you. But menstrual inequity is a global issue. 1 in 4 girls menstruates unsafely. As an OB-GYN doctor, I have lots of concern with that because women should menstruate safely, and it's important that we continue to thread that needle of what's happening globally, what's happening locally. And that's why we need y'all to be, boots on the ground so that we can solve many of these problems, both domestically and globally. Next question is for Mrs. La Paz. So you have an important perspective to share as you help women navigate language barriers in seeking healthcare. How much of a barrier to healthcare is language, and how can we help women communicate with healthcare professionals?
Well, welcome. Thank you for having me this afternoon. And I want to piggyback on what Mrs. Nwaneri was saying. We are a nation of immigrants. I am an immigrant. And when we think about the word immigrant, we think about people who come from many parts of the world, Nigeria, Dominican Republic, Romania, everywhere else. And when we come to the United States, we access healthcare and we come into a cultural shock because, first of all, we access a healthcare system that is quite different from the one we experienced back home. First of all, the healthcare system is complex to begin with. It's the most complex healthcare system in the world. It is difficult to navigate for people born and raised in America, English-speaking Americans. So, and imagine coming from Nigeria, coming from Ethiopia, coming from Nepal, South Korea, the countrysides of South America, and not being able to communicate and not being able to understand what the doctor, the nurse, the medical assistant is saying to you. Years ago, my best friend was stranded in Spain with a intestinal obstruction, and she didn't speak a word of Spanish. And she had to have emergency surgery and was there for about a month at the mercy of the staff, whom she didn't understand what they were saying to her for basic necessities, as even for the food that she was eating, she didn't know what they were saying. And if you put yourself in someone else's shoes and you're at the mercy of someone else, if you have ever traveled somewhere else and you cannot understand what they're saying to you, imagine how humbling that experience may be. I experienced that myself when I first came to the United States and I didn't speak English years ago. And as a tourist, it is a fun experience when you learn to say, hola, ¿cómo está? And you may go to Punta Cana in Cancun and order margaritas, and that's easy. But no one that migrates to another country migrates for fun, unless you have a high-paying job that moved you to another country. Most people migrate because of economic, social, political conditions. Just like we have such a beautiful day in Central PA today, no one said today, oh, it's so beautiful. Let me just head to the emergency room. No one moves to another country saying, it's so beautiful in Egypt. Let me move to Egypt. It's so beautiful in the US. Let me move to the US. Usually you move somewhere else. You migrate because of a better opportunity, whether it's education, whether it's you're moving because of a political, social, economic, educational, health issue in your home country. And in the vast majority of people who move to the United States, they come because of a need, because of a need. And when they come and they face this complex healthcare system and they don't understand this, how to navigate it. And on top of that, they don't understand the language in which they're going to navigate the system. It becomes a major barrier in accessing healthcare. And so healthcare system providers, administrators, educators, concerned citizens, everyone has a role to play in breaking those barriers, in building those bridges, in moving those roadblocks for those individuals who have that experience, especially women. Why? Because as Dr. Emuwa said, women are the ones that are at the center of the family's health. If we don't take care of ourselves as women, we won't be able to take care of our families. And when that family comes as an immigrant, the woman in that family is the one that is going to make the doctor's appointments, is the one who's going to keep track of that child's immunization record, is the one who's going to take care of that family member who is sick, and even adults, the husband, the grandparents, the parents. And if that woman is not healthy, no one in the family is healthy. And the health of the woman impacts everyone in the society. Why? Because immigration and healthcare, the health of that woman impacts not only the family, but the healthcare system that these individuals are migrating to. We had an impact in Central PA when Hurricane Maria hit Puerto Rico back in 2016, 17, I can't remember the exact year, because a lot of people from Puerto Rico who are not immigrants, are Americans, came to Central PA, leaving Puerto Rico because of the hurricane. And we had a huge influx of people who did not speak English that we needed to provide services for. So the services that my department provides, for example, language services, had a huge demand of Spanish in Central PA because of that influx. So the demand for the health systems is higher depending on the influx of immigrants in certain areas. And so when the health of women improves, it improves for not only the immigrants, for the family, for everyone, and providing that access, helping with those, eliminating those roadblocks, with building those bridges, with being partners in their journey is important, because we're not only helping these women, we're helping ourselves as a society. And some people may say at first glance, well, this is America, they should learn English. And at first glance, it might sound like the right thing to say, but it takes a while to learn a language. I've been speaking English for 38 years, and you can still sense my New York Latino accent, and I'm very proud of it. But let me tell you something. Illness does not wait until you speak the language. Illness can strike you at any time. Illness can strike you at any time. And just think about those, even let's not even think about people who have limited English proficiency for the discussion of their health care. We can also think about women who are deaf, women who are hard of hearing. We are just an accident or an illness away, an infection away from losing our hearing. And where do we stand there? So language is really, really important. Communication is really, really important. And it's not only about communication in how we communicate the words we say, but how we communicate in plain language, being able to provide information to women, to patients in a language they understand, in a manner they understand, in simple language, in words that they get, not in medical jargon. And as Dr. Emuwa said, women put ourselves at the bottom of the totem pole in the decision-making about health. We have to start putting ourselves higher up in that totem pole. But we as healthcare providers, as employers, as healthcare workers, or even as concerned citizens, have to put our 2 cents and help be partners in this whole process to eliminate these barriers.
A very smart OB-GYN in Harvard once said that in our society, we treat the birthing person as the wrapper and the kid as the candy inside. And we have to work harder to undo that narrative, that it's not just women are not here just to birth. We are here to serve our community and uplift our community. And so that's one of the reasons, one of the many reasons we are here today. And that segues me nicely into asking Dr. Joshi her question. Your specialty is endocrinology, and you will share with this wonderful group exactly what endocrinology is. And you can share the vital information about health issues for mature women, especially menopause. What do you see as the state of women's health from your worldview?
Thank you so much. And again, happy International Women's Day. And I'm just so proud to be in the middle of these esteemed group of people, to trade my afternoon for nothing better. And before I actually talk on my topic, I would just say what Dr. Emuwa was saying, that women have to have a seat on the table. If we want to make any change, we have to be that person. And we know that we all can do it. No matter what chain you are, it doesn't matter. When I was at UPMC for 25 years, it took me 20 years to become a vice president. I was the first physician vice president in 23 years. And that to say, with great difficulty, and even after that, for 3 years, very difficult to get things done in the middle of that table, because we just have to work harder. And many young women came to me and they wanted me to be their mentor as to how do they progress in their lives. And we actually created a woman physician support group for the first time. We had so many women join us, and that was the only way we could actually get our voices heard. Because when you have 30 physicians talking about salary equity, talking about times, different things we talked about, and it made a difference. So each one of you have that capability, no matter where in the chain you are, is to put yourself first and make a spot for that woman you are. So I think that'll be a great message to give. And now I'll start with my topic. Endocrinology is the study of hormones. So I take care of women hormones, and I focus more on menopause. And I'll start with a story. 20 years ago, my father passed away in an accident, very sudden death. He was very young. And obviously I was going through that turmoil seriously and not sleeping well. And obviously my anxiety levels were high, not focusing. And I just thought maybe there's something else is wrong. And I went to my doctor and asked her to check my thyroid, because we all know that thyroid can cause a lot of these symptoms in women. And she said, oh, by the way, I'll just check you for menopause too. I said, not me, I'm 39. And she said, okay, I'll just do the test. Okay. And she does the test because I went to her because I was not having a menstrual cycle. That's the first alarming sign. That's why I thought of thyroid. And lo and behold, I'm in full menopause at age 39. And she said, I can explain each one of your symptoms. And I said, no, that's not menopause. Menopause is just stopping your cycle. You get a little bit of hot flash and you're done with it. Not true. Not true. If many of your women have either gone through that or going through that, or some young folks who go through that, it is a torture. It's a different phase of your life. I would rather take menstrual cycles a lot more over that. So for 20 years, I had to battle back and forth on estrogen because I was a physician, could not sleep all night. No matter what I tried, I did meditation, I did exercise, I left a very healthy lifestyle, prayed to God, did everything, but could not sleep. So finally, I had to be on estrogen. And every time my doctor would take me off estrogen, I would have the same problem. 15 years later, still battle. 20 years later, still battling. So things can go wrong with some people. Not everybody's in the same boat, but that's menopause for you. So unfortunately, you can get problems with mental, depression, anxiety, mood swings, lack of sleep. And my family used to tell me, Mom, I can tell the difference between you when you're on estrogen and when you're not, because you're a different person. That's how much different it was. So that's just one aspect of life. But the second thing which menopause brings to you is you lose your benefit of being a woman because your heart disease rises the same as men. So we are protecting in terms of estrogen for not getting heart disease, but our risk increases much quicker. And guess what? Another story I want to share quickly is I was talking to a cardiologist recently interviewing, and we were talking about women discrepancy and from men and women when it comes to heart disease and symptoms. And they said, when a man complains one-time chest pain, he's taken to emergency room in 5 minutes because everybody thinks he has heart disease. Guess how many takes it takes for a woman to go to an emergency room? So you have to complain 4 times at home when somebody's going to take you to a ED to see that you have heart disease. And he told me a story that somebody complained that I'm having a little bit of pain and all that stuff. And I told her, I'm an astute cardiologist. And I told her, no, you're fine. It's just anxiety. He said, I called my brother, who is also a cardiologist, and talked to him about symptoms. And he said, oh, this is anxiety. The next morning, their mother, who was 64 years old, was in the cath lab getting a stent. And he said 2 astute cardiologists missed on their mother to take her to the emergency room. So this is the story of life with women, because, we are thought, oh, we are just anxiety provoked and this is what we ask for, or it's a stomach upset. There's nothing wrong with your heart. So that's the second thing I want to share, that you're not going to get rid of that heart disease. So if you have not gotten your testing done, get your cholesterol, get your blood pressure under control, get your diabetes under control, get your weight under control. The third big thing which happens with menopause is you are actually going to gain 10 pounds, whether you like it or not. Unfortunately, the metabolism slows down. I mean, you literally cut down by 30% and you still gain weight. And you do exercise and you don't lose weight. So many times my patients get very frustrated that I can't help them. But I said, you have to sometimes live the norm of life. I can't change that. So those are 3 things that happen in early menopause. And then finally, it rubs you the wrong way with osteoporosis. So 1 in 2 women would have a fracture in their lifetime after menopause. We don't recognize that because estrogen is so protective that once you lose that estrogen, your bones start to break so easily and you develop something called as osteoporosis. Osteo means bones, porosis means holes. So your bones get weaker. And then when your bones get weaker, you have a higher chance of having a fracture. We focus so much on breast cancer and cervical cancer, and true, we do, because those are the cancers. But osteoporosis and leading a poor quality life in a nursing home because of a hip fracture is 10 times more common than getting a cancer. So I'm not saying we don't focus on cancer. Yes, cancer takes life away. Absolutely you do. But don't forget about osteoporosis. So that's the time after menopause when you need to talk to your doctor. When can they do a DEXA scan? It's a very simple test. It's covered by every insurance above 65 years of age. I would argue, why wait even 65? We have high mark in the audience. You know, if you start focusing a little sooner on prevention, you are actually going to prevent fractures. And we don't, because we don't get coverage for DEXA scan till 65. So what I tell women is to start building strength, do your exercise, especially muscle strengthening. If you walk, you're good. If you do cardio, treadmill, you're good. But if you don't lift weights, you have a higher chance of fracturing. So each one of you go home and start lifting 2 to 3 pounds. 10 minutes, 10 minutes, 10 minutes, 3 times a week, not asking for much, okay? And that way you can build your muscles so you don't break a bone when you get a fracture. Or when you, when you fall, you don't break your bone. And then the third thing of which you want to do is vitamin D. And that, again, takes it to a global perspective. When I served my time in India, when I went back home, the woman had osteoporosis at age 50 or 55. And when we did nothing but just supplemented them with vitamin D high dosages for 2 years, their bone density improved like this. So again, you look globally, different part in the world, people are suffering from different problems. Even here, vitamin D deficiency is so common that every person after menopause who comes to me, I check their vitamin D, I check their iron. Because women, despite taking care of the family, don't take care of themselves. Yeah. So you have 3 messages to take home. I'm going to keep it short and sweet. Take care of your health. Go see your doctor if you have not seen, and keep once a year appointment, as other folks have already said. Make sure you take supplemental vitamin D. Doesn't hurt much to take 1,000 of vitamin D daily. And number 3, keep up with your exercise and get your screening test, whatever needs to be done, especially the cholesterol, the pre-diabetes, the high blood pressure. And if you can save those 3, you're going to save heart attacks and you're going to save fractures. Thank you.
Wow. In 2002, there was a study done, the World Health Initiative, where they looked at, the goal was to see what the incidence was of heart disease on women taking estrogen. And unfortunately, we saw a small uptick. It wasn't even statistically significant, but we saw a small uptick in the incidence of breast cancer and venous thrombosis, blood clots in the legs. And so some news outlet got hold of that in 2002, and they misrepresented the information and made women think that if you took hormone replacement therapy, you were at increased risk for breast cancer and blood clots. And so 80% of the folks in my field, in my sphere of medicine, stopped taking it. We know that hormone replacement helps. It does everything that Dr. Joshi just said that we need to prevent. And so I think it's important to level set as well that we have misinformation feeding the public data that was unfortunately misinterpreted, because we know hormone replacement therapy. I'm an OB-GYN doctor, so obviously I am a huge proponent of hormone replacement therapy. Hormone replacement, the average age of menopause in our country is 52. If you are in full-blown menopause, your estrogen levels are low, that means you're at risk for Alzheimer's, heart disease, 1 in 4 of us, unfortunately, will die of a heart attack, colon cancer, and osteoporosis. You need hormone therapy. We're living longer. We live in a highly resourced country. You need hormone replacement therapy, and it is safe. For every 10,000 women that takes hormone replacement therapy, only 8 more will develop breast cancer. You don't have to be a 5th grader in math to understand that number is small. So without further ado, thank you, Dr. Joshi. Yes, please, please.
Sorry, I don't want take your time away. But the first 5 years, the hormone therapy is completely safe.
Yep.
The breast cancer risk is all cumulative. So the much more longer you take, and if you keep doing your mammograms and you do your self-breast exam, you can prevent that. So that's why I think what she said was, Dr. Livingston said was absolutely true. If you're miserable because of menopause, there's no risk and no harm in taking hormone therapy.
Mrs. Tugulia, you're up next. We know the state of women's health is not just a physical issue, but a mental one. Can you talk to us about the state of mental health for women, especially as we consider the ongoing impact of the COVID years?
Thank you for the opportunity to address this topic. And before I get to it, I would like to join in and also wish everyone happy International Women's Day. And of course, I'm Romanian, so I have to wish you in my own language. La mulți ani de ziua femeii internaționale.
Yes.
And because Evelyn is sitting right here next to me, feliz Día de las Mujeres Internacionales también. So it was mentioned at the beginning of the presentation that I am originally from Romania. I was born and raised the first 20 years of my life in Romania. Mental health was something that was definitely never discussed, or if it was, it was associated with a lot of stigma. Mental health, it wasn't something that was promoted among us as something positive, as something that is a need, as something that is okay to seek. It was not promoted as something that is as important as physical health or any other kind of health or wealth that we try to achieve. And we all know that all these are interconnected. So when we think of mental health from a global perspective, I think we can't help ourselves to not think also physical health, social, economic, spiritual, education, resource health, and relationships, because all of these are interconnected and they are all crucial to a woman's success, well-being, and overall health and wealth as well. I think that one cannot go with the other, and we cannot talk about one and not the other. No matter a woman's ethnicity, whether you're from Romania, whether you're from United States, whether you're from Puerto Rico, whether you're from Nigeria, whether you're from Ghana or any other country in this world, I think no matter the ethnic group we belong to, background, interests, these categories of health and wealth are crucial to attaining wholeness and wellness as well. So when one is lacking, there is not a good balance. And each one of this is a step closer to promoting a woman's health. So I think we cannot speak of a woman's mental health or treat mental health without thinking of finances that brings provision and attends to a woman's health. Spirituality is very important. It brings comfort and it aids to a woman's mental health, combating depression and trauma as well. You got to have something to believe in. When everything is going down, when there is no hope, when maybe there are no finances, when maybe there are no resources, who you're going to turn to. And I'm not saying you got to pick one specific one, but find something to have faith in, something to believe in. Education brings guidance to make good health decisions. Resources bring options to choose from when it comes to a woman's health. Social supports helps a woman's health by allowing her the time she needs to assess her own mental health and pursue help when it's needed. So what is the current global state when it comes to a woman's mental health? 1 in 4 individuals around the world will develop mental illness at some point in their lifetime. Women are impacted at a higher rate than men, with 1 in 5 women experiencing mental illness. And I think Dr. Emuwa touched on that during her presentation. She mentioned it doubled up since COVID, and it doesn't look like it's getting better. And it's women all over the world, not just United States. So it is our responsibility to remove that stigma, to promote mental health as something positive, to encourage people that it's okay to seek help. And we need to develop policies that will address that, policies that will also change them, create new ones, but also come up with practical ways to help women. Very often I see this picture of a woman with probably like 20 different hands illustrating all the roles that a woman, all the responsibilities, all the different roles that a woman plays in our society, in our home. You mentioned, you know, in a household, who does all the appointments, who cooks, who cleans, who watches the kids, who gives birth to a child and has to go to work right away. There is no time for healing. There is no time for physical healing, for emotional healing, for mental health healing. The woman plays so many different roles. So we need to create policies that will support and provide practical help to a woman. You know, personally, I am so tired every time I hear someone say, make time for self-care. How can I make time for self-care as a woman when I work an 8-hour job and then I go home and I have to cook and I have to clean and I have to take care of the children and I have to schedule appointments and I have to attend my children's events at school, because it's very important that you are a parent as well. And then learn English as well. Make sure you learn English. Make sure you get to be educated too, because everybody else says you got to be an educated woman, right? And in some cultures too, there's the expectation, right? Even from the men, I want an educated woman. So go ahead and, you know, make sure you get some 3 degrees and get a doctorate degree, because I want your name to say Dr. So-and-so when I present you as my wife. So all of that, if we want women to have time for self-care, we need to find ways to remove some of those responsibilities. So to me, instead of some kind of conference or policy, I want you to develop some kind of service that will help me, so then I can get some kind of support with my child while I get to go to an appointment, while I go and do something that will really help my mental health. And if in our society, if there are some services that allow for help with childcare, there's a lot of stigma associated to that. So there is a lot of work that needs to be done around the stigma. We need to stop judging one another. We need to empower one another more, and find ways to be inclusive and appreciate one another, because you know what, at the end of the day, your success is going to be my success. If you're a doctor, guess what? When I get sick, thank God you're a doctor, because you're the one who's going to heal me and is going to heal my child. You know, if you're getting a degree somewhere, thank God, because if I need a resource, I can come and ask you. So your success, I want to see you succeed, because your success will benefit me. Not that I want to be selfish, but I think that's the attitude that I think we should all try to adopt, to empower one another, to see one another be successful. There's no competition. There's only good competition if we want it to be a good one. So I know there's not a lot of time left, and I will conclude with that. Remember to be kind next to the person next to you. You know, we always hear people say, you never know what somebody's struggle may be. Somebody may sit next to you, may be smiling, but God knows their mental health condition at that moment. So you can make a difference. You can truly make a difference. So I will leave you with that today. And thank you for the opportunity to share.
What an amazing panel. Phenomenal women, phenomenal people, phenomenal humans. I am going to yield the floor back to Joyce, and I think we may have some folks virtually who may have questions, and we'll finish up here.
Well, I mean, you don't have to yield it, but it's your turn. Since I know you guys have questions, we'll take those microphones. There's our Phyllis over there. She's got the first question. And she's an expert in the Kidney Foundation.
Hi, I'm Phyllis Hicks, and I wanted to ask this question. It's kind of personal for me. I'm wondering if I came into my physician's office with specific symptoms, if they would be likely to recommend HRT and bone density studies. I'm a 68-year-old woman. I have a male provider. He's a fabulous person. I really have been going to him for a long time, but he's never once talked to me about bone density study or asked me about menopause and whether I might benefit from HRT therapy. Now, I went through it, but I'm really thinking, geez, that would have probably everybody in my life, my husband, my kids probably would have been like, thank God somebody helped you have something. And I'm just wondering, are there studies that maybe, do we have information that if I'd had a female provider would I have been more likely possibly to have had that person say to me, Phyllis, you're 65 3 years ago. And I think you really need to have a bone density study, or, would you need some support with HRT? Never mentioned. And he's a fabulous human being and a great, great doctor.
Very interesting question. And I think, Sharee, I don't know what you feel. I feel like females do sympathize with females more. That's just my opinion, but I may be biased. So
you're exactly right. As OB-GYN physicians, we know in 1970, the number of OB-GYNs was 80%, 80 to 85% males. That number has turned on its head. Most of us probably can't think, besides the wonderful Dr. Bakare, of some amazing male OB-GYNs, but we are seeing a significant number of female OB-GYNs, and it's just that natural progression of folks feeling more comfortable being receiving care by women, especially with such an intimate physical exam. There was a great study that was done out in Oakland, California, that talked about cultural congruence. So when you ask the question of, are there any studies that show that female providers provide somewhat of a different care for female patients? I don't have that answer, but I do have the answer that besets the Oakland study, which showed that if cultural congruence is present, health outcomes are improved. People are more likely to adhere to 3 things: 1, preventive care regimen; 2, treatment plans; and 3, participate in research. So I think we can borrow the results of that Oakland study and presume that if there is some type of similar lived experience or cultural congruence, be it race, sex, gender, religious orientation, or whatever, that we can kind of draw that line. Dr. Emuwa.
I can comment on that from the South Asian perspective because I'm an Indian, and I can tell you a lot of our folks go to doctors and they give them a dietary counseling and they give them the diet which average American eats, and we don't eat any of that. So they go home and they say, this doesn't belong to me. I'm going to do what I'm going to do. So I feel the same thing, that cultural congruence is so important when we talk to. So one of my friend actually sat down, looked at all the Indian diets, did calorie counting, carb counting, fat counting. And now that's so popular among every person because now they can finalize and see, okay, this is helping me. So it is so important. I don't think the gender study has been done, but I'm sure it will be done. It'll probably point toward the same direction.
I agree. Yeah. Good question. Other questions? Oh, in the back.
Hi, I'm Christine Beer. I thank you all for wonderful presentations. But I think it's become obvious to us now at a really fundamental level that worldwide, and certainly here in the United States, males, for whatever reason, and I come from a family of wonderful males and know those as practitioners in healthcare as well, but they have a different purview and some things are just outside of that. And so in my experience after being in health and wellness for 50 years is, if we want the societal change and policy changes that are necessary, we need to do one thing, and that's vote, and that's vote for women.
Yes. Wow. Mm-hmm.
Hello, I hope you don't mind. I'm not going to stand right now. I am very pregnant. Yes, I'm exhausted. So I might be a slight outlier in the group because I am not affiliated with really any nonprofit or related to any kind of health organization. I'm here, 1, because I was pregnant and it sounded interesting, and 2, because I am passionate about women and being able to help at least my friends that work in health fields find ways to fill that gap in the health disparities. So I guess my question is for people that are not in this field. And for example, I own a marketing agency, very different, very different world. What can we do to assist and help in this field, in this area, if we are not necessarily called to be policy changers and researchers and things like that? How can we assist in the fight for women's equality and women's health from the sidelines?
I don't mind addressing that question to some degree because it really piggies back from the opening statement that I made, where I stated that women, no matter your background, no matter your stance in society, no matter where you see yourself in the stage of life, there are so many different ways you can involve yourself towards improving women's health in our world today, whether it's yours primarily. So starting off with you, reflecting. I don't know what pregnancy this is for you, but asking ourselves on a personal level, I'm in marketing, I have a job, I have to take care of myself. I have to take care of myself to take care of my child. So no matter what your field and you're human. So I think the call is for all women to start off by making a difference to themselves, then start thinking of the people around you. Now you've come to this talk, now you've reflected. I want to be healthy. Pick up the phone, your sister, your friend. When was the last time you went to the doctor? Have we reached the age for mammograms? So you don't have to be in healthcare. They may not be listening to their doctors, they may listen to you. So start thinking about people within your sphere. Then even think within your organization. That's why I use the charge, people within the organizations. Are you a supervisor of any sort? When someone comes to you with a question or they have issues with childcare, etc., what can you do to allow that person the flexibility to take care of their health or their child's health or their family's health or their own mental health? Someday you may be in a position where you'll remember this talk and say, I can make a difference in my organization. You may see an opportunity, Dr. Joshi said, where you'll see an opportunity and say, you know what, I never thought I could be in the C-suite in my organization, but maybe I should. Maybe I should be a voice. Maybe I'll be the first woman market. Maybe because of me, some policies will change within the organization. And then last but never the least, I did mention too, and I know it kind of seemed like minutia, but even if you cannot think of anything, there's so many ways to be involved in nonprofits around the world. Here in the United States, here in Harrisburg, within your organization, what can I do to volunteer? And volunteering doesn't mean you have to go every day. You can volunteer within your church, you can volunteer within, you'll be surprised. You'll not be like, maybe with my child's soccer, I could go to the, pantry with them. You volunteer. And even if you can't, even if you take $5 and say, you know what, I'm just going to drop this $5 for this organization helping women with whatever. We have nonprofits here today. So even $5 can make a change. Some people say, oh, but you can't save the whole world if you donate, $1 here or there. But that one woman who that $1 helped to get food for her child, it made a difference in her life. And as Tabita said, you never know tomorrow, where you'll be. So you can help in so many ways. Hopefully this has even started, it's a tip of the iceberg, but hopefully this has given you so many different ideas. I don't know if any of my fellow colleagues want to share.
Just wanted to share, Facebook is such a powerful tool. And I see this fast growing trend where there are a lot of mothers groups. There is Moms of Mechanicsburg, Moms of Harrisburg and Hershey groups. There are like 5 different groups. And on a daily basis, I see so many women, single moms, so many women reach out and post on these social media groups, asking for resources, asking for practical needs, asking for directions and guidance. And while Facebook may not be the best way to seek, help, that's where a lot of women are going. And I've learned personally that I can go on those groups, and if I know of a resource, I can post it. I can guide a mom. I can tell her, hey, here's where you can find, a good daycare. Here's where you can find a food bank. Here's where you can find mental health resources free that you don't even have to pay, or you don't have to be involved with a child welfare agency or any other organization. So that's a way to create impact as well and help those around.
One line I can add to that is one of my biggest pet peeves. You go to Europe or any other countries, the pregnancy, the leave, maternal leave is 1 year. Your job is protected. Yeah, your job is protected. Only in US, as a woman, you have to go back in 6 weeks to 3 months where your mental health is devastated at that time. And I remember my first child that I was a fellow, so I had no time. 4 weeks off, went back to, and they called me back on a Friday, didn't even wait till Monday morning to get me there. And then my boss in June, after 6 months, gave me my first day off. He said, you need a time off with your child. So that's how bad it is here, because work is priority for everyone. So I think that may be something, a movement. Movement has to be started. That's all. So you may be that movement starter, and then go on Facebook, go on Twitter, as I said, it's just a thought that I think all women need to have more time with their child.
Yeah. And to piggyback on what Dr. Joshi just said, I would like to ask you, the audience, do you know by any chance the world's most generous parental leave policies, the country that has the most generous policies when it comes to maternity leave or parental leave overall? Good job. Wonderful. That's right, Sweden. So Sweden is considered the world's most generous parental leave policy led country. When a child is born or adopted in Sweden, both parents are entitled to 240 days. If more than one child is born into the family, an additional 180 days are permitted. So how many days are in a year? 365. So basically they have about a year or a little bit over off work to focus on their mental health, their home, their family, bonding with their child. And guess what? It's not just the leave to make it, even better. Parental benefit is paid for 390 days at the sickness benefit rate, or between $250 to $1,027 per day, and for the final 90-day at $180 per day. So you will have all your days that you're off paid for, so you have time to focus on your family. And one thing that I do appreciate about my own native country as well, Romania, they give you about a year also off work, and they pay you 80% of your salary without needing to have any sick personal or vacation time accrued to utilize. So there are countries out there with better policies. I'm not putting anybody down. I'm just saying, just like Dr. Joshi said, I think we do need to advocate for better policies when it comes to women. And I think if women are taken care of, just like all our speakers said today, everything else to follow will get better as well.
Any other questions? There's the microphone there.
I just have a statement. I don't need the microphone. I would like to talk to you afterward because marketing is really, really important.
Use a microphone, please, so the folks online can hear. Thank you.
Okay, thank you. Let me be thoughtful of everybody. I forgot there are people online. Apologies to the online people, and thanks for the reminder. I just said I wanted to meet. Tell me your name. Caitlin. I'd like to meet Caitlin after, because I think something that's important to point out, especially with nonprofits. I work for a small local healthcare nonprofit, and there's a lot that you can do, especially if you're in marketing, volunteer, and help us run fundraising campaigns. I mean, women are more impacted by kidney disease, dialysis, needing transplants, because they're all living with chronic disease and being caregivers for the family. And oftentimes they are disproportionately impacted when there are healthcare issues with the family. So I'd love to talk to you, because there are things you can do, and I'm not the only one if there are other people in the room, that you can do remotely from at home with your baby after you wake up and after they wake up. But there's a lot you can do. You're in marketing. Let me tell you, people should be standing up in line to talk to you, because you're a huge influence in getting the word out for healthcare, for women especially.
Phyllis is absolutely right. All of these organizations can use a marketer and to communicate and to change the attitudes in our society. You're an influencer. You know how to do it too. They need to know how to communicate like that. They really do. Because the other thing that Christine said, I want to emphasize that too, before your questions can still be taken. Vote.
Yes.
That's vote. And I'm not going to be like Christine. I'm not going to say vote for women, although I do think we should vote for good women. Don't vote for bad women, because they exist. But vote for, if you stay home this election, shame on you. Everything's on the line. Everybody, but really, everything is on the line. No matter which side you are, it's on the line. Okay, you need to be out there and make your voice heard. Go ahead. Go ahead.
I just wanted to say, if anybody has any medical issues, as Joyce very kindly mentioned, me and my husband run Joshi Health Foundation on Carlisle Pike. So we do see patients for free, lab work for free. So if you want anything done, or if you don't have money to come see us, just come.
Isn't that incredible?
Wow.
Huh? The Joshi. Yeah. It's amazing.
When you're spreading the word, don't forget about spreading the word in other languages as well. There's so many patients out there that need the information in their language. The CDC has a lot of material that can be shareable in other languages. And the last census shows that 22% of the US population speaks a language other than English at home. That means that 4 out of 10 people, look at this room, 4 out of 10 people in this room speak a language other than English at home. And that population needs the information in the language they speak.
And just on that point, I want to share something with you. We were approached by people from the Bhutanese community in our area. They are going through something. The women, the girls are going through a lot. There have, I think, 3 suicides. They are begging for help, right? This is a real crisis in that community, the Bhutanese community. They are now trying to figure out how they can get grants so they can start a program. But again, it's a new culture to them. They don't know how to navigate all of our foundations and all of that, right? So honestly, if they, and again, marketing, getting the word out, they contacted me because I can at least write about it and let people know about it. But there's a real need there. And these are young girls who don't know where to turn. They don't know who to turn to. And the families are not really in a good position to even be able to help them, right?
And any organization that receives federal funds, if you receive Medicaid, Medicare, CHIP, any federal funds, police departments, healthcare organizations, education organizations, the departments of education, any organization that receives federal funds is required by federal law to provide these language access services free of charge to the individuals. And individuals don't know this. So they don't know that it's their right to receive effective communication resources.
You're right about the language, but as we all know, sometimes it's not just language. You know, and you know, I was just thinking, even when you guys were talking about going to doctors, you know, most of my doctors all my life have been white men, and I didn't tell them everything, right? I'm not going to tell them what I'm telling my black woman doctor right now, who I have, right? I tell her everything. But that's just the truth.
Culture,
it's a cultural and it's gender. It is. You're more comfortable. Go ahead, Dr.
That's why it's important to really diversify healthcare so that people have different experiences. If you come to know, and it doesn't mean that people necessarily choose only certain providers, but when you come into any healthcare organization and you have people there from different parts of the world, so organizations should value diversifying their staff. They should value that. And that should really start from childhood, from growing up, you know. And so I really feel like organizations should take that step when they're hiring, when they're seeking people, regardless, definitely in leadership opportunities, as we said, but just the organization in general. An organization should have pride in diversifying their staff, not just because it looks good on paper or checks a box off, but because that's the best way they can connect, allow patients to see the breadth, and allow people in that organization to come to the table and say, these policies can be adjusted this way. Have you thought of this for this? Have you thought of that for that? So this is a great segue into that reality. For women especially, let's allow organizations to take pride in diversifying their workforce for multiple reasons, but especially for reaching out to women in our special needs.
And nowhere is that more important than mental health, because I recall even when I was younger with my grandmother, who really needed, but there was no way she was opening up. Rural, well, not rural, but in the South, she's not going to open up to a white man. I found a white woman psychologist, but that was just like saying, yes, ma'am, no, ma'am.
And I just wanted to piggyback that when I thought of, you know, even from childhood, we really need to encourage our young women to go into STEM, you know, careers. And a lot of women and girls will think, you know, girls will think, oh, math, the boys are good in math. And you'll be surprised, you know, you'll think now, oh, STEM is a thing. But we really need to encourage our young girls to see that if they have interest in science, they too can be scientists. So, you know, even with your own children, with your own nieces, your own grandchildren, make sure you're not allowing the stereotype to occur in their life. Ask them, or what are your interests? Don't laugh if they say, I like this, you know, encourage them, put them in programs. There are programs out there that are growing about girls in STEM. Let's just take that seriously, because our generation is going to pass away one day. And so we want to make sure that channel continues. So just wanted to put that out there.
That's a good point.
Yes, I have one more marketing job for you. You're going to be sorry you told us you're a marketing. No, but I'm a retired family physician, and I had 5 children, and my husband was our stay-at-home parent. And there were 3 other husbands in our neighborhood of professional women who were also stay-at-home parents, which was a good support network for my husband at that time. I feel like in marketing, we as women tend to think we're going to do it all. We're going to solve all the problems ourselves. But we made our children with another person involved. Okay. And that person also can learn that there's not just work involved in raising your children firsthand, but also a lot of joy involved and a lot of reward involved in seeing your children grow up and being part of their lives in all of those things. So as a marketing thing, I think it's very important that we are also marketing to the men in our society, the importance of sharing household responsibilities, the importance of sharing childbearing, not childbearing so much, but child raising responsibilities. I had a deal with my husband. I'll carry the child the first 9 months, the next 9 months you carry him, and then after that we'll share it. Okay, so that way it made it fair, but I think that that's a really important marketing thing. And what Mrs. Nwaneri was saying about men dominating the lives of women in Nigeria, as long as we are allowing this to continue as a power struggle, men controlling women, women being workers, slaves, people who do the will of our husbands, fathers, whoever. I think it's important that we market to men the importance of sharing their lives with us in a more meaningful and beautiful way. So that's a really important thing for all of us to be happy, because it shouldn't be the war between the sexes, women, we're going to solve our problems, men are going to solve theirs, just we should be in this together as a human race,
That's
Beautifully said. Thank you.
Yeah. I wanted to say, if the penguin does it, then we should do it too. Penguin bird, mother gives the egg to the father and he sits on it and waits for it to hatch. So.
And men are capable. I
And they
mean,
are.
I have been blessed. I truly have, because I've had a full partner in my husband who cooks every night, right? So I can go and
Wow.
sit down. And he loves it, right? And when we adopted our son, Cole, who many of you know, the first thing I said, oh, we want to adopt a child? Okay. Are you prepared for 75% of the work? He still did 50, but I made him prepare for 75%, and he accepted, and it was a joy. It's a joy. So we shouldn't deprive them of the joy of cleaning the house.
And I think Joyce, one of the things we actually do is, as somebody said, the woman just wants to do it all. So even if men are cooking, I might be standing on his shoulder. Oh, can I help you with this? Can I help? No, you need to go away. You want to watch a movie? You want to go get your facial done? You want to get nail polish done? Do it, please. Let them do it. And I think when I had my shoulder injury, before that, I was cooking and doing a lot of stuff. And I said, I'm going to stop doing grocery. That's just not me. My shoulder is killing me. So I told him, I said, I can order online. Your job is to pick up, bring it, and put it back. And he learned it. He learned it very quickly. And now he always volunteers. I can just do that. You know?
Well, I think we have to close it here. I'm going to allow Dr. Livingston to have the last word on this, but I want to thank you all for coming. And that lady back there, Phyllis Hicks, will be. Well, I was going to say you're going to be one of the speakers March 23rd, right? At the Women's Forum, Save Women Health Pennsylvania. We'll be focusing more on Pennsylvania. Kathleen, did you want to have a closing word? Come on up, and then we'll turn it over to Dr. Sharee to close it out, the health of women.
Thanks, Joyce. You know, I'm only doing this because Phyllis said you should do that. Thank you, my friend. So I do community affairs here at Highmark Blue Shield, and it's just been amazing to have Joyce here this year and last year. We have so many great events here with the World Affairs Council. I can't tell you what a great partner they are. They always bring in the greatest crowds and people online who are interested, and we had amazing subjects. I mean, people are still talking about the last one, and I don't know what's going to happen after this, Joyce, but you're going to be really busy. We might need Russell involved in this, feedback thing too. So, but I want to thank you all, and our doctors, thank you all. You're all so amazing. It's, It's great to see women of color in our, healthcare profession, especially you, Dr. Livingston. You're an amazing, inspiration to all of us here in Harrisburg, even though you live in Lancaster now. We let you come back on this side. So thank you all for being here. Please enjoy the snacks. Please enjoy, there's restrooms around the corners, but, we'll walk you out at the end, but we just want to really all thank you all for being here. We're, a health insurance company, so we're very concerned about women's health. And this is the best day ever to talk about women's health on International Women's Day. So thank you all for being here. Joyce?
That's a great way to end. I think that we want to thank our panelists, thank Joyce, thank Highmark. We have had a wonderful afternoon together. We have learned lots of information about statistics and solutions. So we urge you to take what you have learned today back to your respective communities and invoke change. So happy International Women's Day.
Just each one of you have a little bit of a token of thanks from the World Affairs Council, a crystal globe, because of your vision for a better world. And you already have a globe, so we're giving you, there you go, a little mug in here from the World Affairs Council. You can remember us.
Thank
Okay.
you.
Bye-bye, everybody.